Hello everyone, welcome to this audio podcast. This audio podcast is a part of the LabZtorm and Diggamount. This audio podcast is part of the component in Storm and Lobostics. This audio podcast is part of the Shipmo Squad, and this audio podcast as part of a Storm Lobostics production. Through this audio podcast, a little bit in around managing aspects in around anemia, and just to iterate, this is managing anemia or context of anemia in SCA, aspects of SCA, sickle cell anemia, thalassemia, but also in line to some of some of the some aspects of the transfusion practice, transfusion blood transfusion practices as well. So consistent with sort of some of the recent changes perioperative transfusion practices, for example, namely the lowering of transfusion triggers for red blood cells. One investigation had found, for example, that severe anemia after major surgery, for example, is now a common occurrence. Consequently, recipients or patients had undergone major surgery and were screened, and 25% were found to have severely anemia on the morning in around post and around after surgery with a hemoglobin concentration of 70 to 90 grams per liter. The the team, investigators had informed that early post-operative treatment with intravenous iron alone or in combination with erythropoietin, which is erythropoietin is just to iterate is a recombinant sort of a recombinant pharmacotherapy that is administered subcutaneously, where it, where the pharmacotherapeutic um, when administered, it is where it actually helps stimulate particular helps stimulate red cell production or red cell synthesis in those who have for example symptomologies around anemia. So the team concluded that post-operative treatment with intravenous iron alone or in combination with EPO does not appear to accelerate early recovery from post-operative anemia. Unfortunately, at the same time, there's little research or little works that have been conducted to investigate to investigate or sort of duplicate this particular investigation to establish whether managing anemia in the chronically ill or untransfusible recipients or patients in the same manner would be advantageous. Such prospective works or research is required to make to actually look at comparisons. At the same time, at the same time, one investigation also retrospectively investigated the association of EPO use with with hemoglobin recovery in low hemoglobin untransfusible hospitalized recipients or patients. EPO treated recipients were identified through a combination of retrospective case review and systematic review, and literature reports of untransfusible patients not treated with any EPO were used as a comparator cohort. Investigators established that that hemoglobin recovery was higher in recipients with lower baseline levels, irrespective of EPO use. So no association at the same time was identified between the rate of hemoglobin recovery and EPO use, and dose or therapy or therapy duration. So in anemic untransfusible hospitalized patients or recipients, EPO use was not associated again with an increased hemoglobin recovery, and um, at the same time, however, the investigation did not include sickle cell anemia, anemic or thalassemic cohorts as untransfusable patients or recipients at baseline, which may have provided or could have provided some important insights on how to offer blood transfusion practices in recipients or patients with such hemoglobinopathies. That draws this audio podcast to a close. This audio podcast is part of the LabZtorm Diggamount. This audio podcast, this audio podcast, this audio podcast is part of the Capola and Storm and Lobostics. This audio podcast as part of the Ship Mode Squad. This audio podcast is part of a Storm Lobostics production.